Have you ever wondered how anesthesia systems work to keep patients comfortable during a surgical procedure? Let's take a closer look at these fascinating medical marvels. Anesthesia systems play a crucial role in the realm of medicine, particularly in surgical procedures. Their primary function? To deliver a precise amount of anesthesia to patients, ensuring they don't feel pain during surgery. But that's not all. These systems also maintain appropriate life functions during the operation, monitoring vital signs and adjusting the delivery of anesthetic agents as needed. In essence, they're a patient's lifeline, silently working in the background while surgeons focus on their task at hand. The use of anesthesia dates back to ancient times, but modern anesthesia systems are a product of years of scientific discovery and technological advancement. It's a beautifully complex synergy of physics, chemistry, and biology, all coming together to ensure patient safety and comfort. These systems are designed with the utmost precision, as they need to accurately control the concentration of anesthetic agents delivered to the patient. Too little, and the patient may experience pain or wake up during the procedure. Too much, and it can lead to serious complications. It's a delicate balance that requires both a deep understanding of human physiology and advanced technology. But anesthesia systems do much more than just deliver anesthetics. They also provide oxygen and remove carbon dioxide, helping to regulate the patient's breathing. In addition, they monitor and control body temperature, fluid balance, and even heart rhythm. It's no exaggeration to say that anesthesia systems are one of the unsung heroes of modern medicine. They work tirelessly, allowing doctors to perform complex surgeries with minimal discomfort to the patient. In the hands of skilled anesthesiologists, these systems help save countless lives every day. Now that we've set the stage, let's dive into the components of anesthesia systems to understand how they work. At their core, anesthesia systems consist of several essential components. These components work in harmony to ensure the safe and effective administration of anesthesia during surgical procedures. Let's start with the anesthesia machine. This is the heart of the system. It delivers the anesthetic gases that make the magic of painless surgery possible. The machine controls the flow and mixture of gases, ensuring the right balance to keep the patient unconscious, pain-free, and stable throughout the procedure. Next up is the breathing system. Its role is twofold. Firstly, it delivers oxygen to the patient, a critical element in sustaining life during surgery. Secondly, it removes carbon dioxide, a waste product of respiration, from the system. This dual function ensures the patient's body is properly oxygenated while preventing the buildup of potentially harmful gases. Now, let's talk about monitors. These are the watchful eyes of the anesthesia system. They track patient vitals such as heart rate, blood pressure, and oxygen levels. This continuous monitoring allows the anesthesiologist to react swiftly to any changes, making adjustments as necessary to maintain patient safety. Last but not least, we have the anesthesia workstation. Think of it as the command center. This is where the anesthesiologist controls the system, adjusting the flow of gases, monitoring the patient's vitals, and making real-time decisions based on the patient's needs. The workstation is designed to provide easy access to all necessary equipment, while also offering a clear view of the patient and surgical field. In essence, the anesthesia system is a symphony of interconnected parts, each playing its part to ensure the safety and comfort of the patient. The anesthesia machine, the breathing system, the monitors, and the workstation work together seamlessly, providing the anesthesiologist with the tools they need to manage the patient's anesthesia effectively. Each component plays a critical role in ensuring the patient's safety and comfort during surgery. The anesthesia machine is the heart of the anesthesia system. The role of an anesthesia machine is akin to a maestro conducting an orchestra. It stands at the center of the anesthesia system, orchestrating the delivery of a precisely calibrated mixture of gases and anesthetic agents to the patient. The machine does this through a series of core components, each playing a pivotal role in the process. Let's start with the vaporizer. Think of the vaporizer as the chemist in the machine's ensemble. It takes the liquid anesthetic and heats it until it vaporizes. This vapor is then mixed with the gases within the machine. The vaporizer ensures the correct concentration of anesthetic is delivered, allowing the anesthetist to manage the depth of anesthesia with precision. Next, we have the ventilator. The ventilator is the lungs of the anesthesia machine. It ensures the patient's breathing remains steady and consistent while they're under anesthesia. With rhythmic precision, it inflates and deflates the lungs, delivering the anesthetic gases to the patient. The ventilator is an invaluable tool, especially during long surgical procedures or when a patient's spontaneous breathing needs support. Lastly, let's not forget the gas delivery system. This component is the courier of the machine, responsible for transporting the anesthetic gases from the machine to the patient. It does this through a series of tubes, valves, and flow meters. The delivery system ensures a smooth and continuous flow of gases, maintaining a stable and controlled environment for the patient throughout the procedure. Together, the vaporizer, ventilator, and gas delivery system turn the complex task of administering anesthesia into a well-orchestrated process. They work in harmony, each component playing its part to ensure the patient is safely and effectively anesthetized. Understanding the roles of these components unravels the mystery surrounding the anesthesia machine. It's not just a complex piece of medical equipment, it's a finely tuned system designed with the patient's safety and comfort in mind. Armed with this knowledge, the anesthesia machine no longer seems like an enigma, does it? Breathing systems and monitors are vital components of anesthesia systems. Let's start with breathing systems. These systems are responsible for delivering a carefully balanced mix of oxygen and anesthetic gases to the patient, while simultaneously removing carbon dioxide. The system comprises a series of tubes and valves that work in harmony to achieve this. Essentially, the breathing system is a conduit for the patient's breath. The oxygen and anesthetic gases are carried in one direction from the anesthesia machine to the patient, and the carbon dioxide is carried in the other direction, from the patient back to the machine. This two-way traffic is maintained by a system of valves which ensure that the gases flow in the correct direction. In the breathing system, the carbon dioxide is removed by a component known as the soda-lime canister. This canister contains a chemical compound that reacts with carbon dioxide, effectively scrubbing it from the gas flow. This ensures that the patient is not rebreathing their own carbon dioxide, which could lead to complications. Now let's move on to monitors. Monitors are the eyes and ears of the healthcare professional administering the anesthesia. They provide real-time data on the patient's vital signs, such as heart rate, blood pressure, and oxygen saturation. By closely tracking these parameters, the healthcare professional can adjust the level of anesthesia as needed, ensuring the patient's safety. Monitors also serve as an early warning system. They can alert the healthcare professional to any changes in the patient's condition that may indicate a problem. The monitors continuously check the patient's vital signs, and if anything goes awry, they will sound an alarm, allowing the healthcare professional to respond swiftly and effectively. These two components, the breathing system and the monitors, work together like a well-oiled machine. The breathing system ensures the patient receives the right mix of gases, while the monitors keep a watchful eye on the patient's condition. By now, you should have a good grasp of how these components work together to ensure patient safety. Finally, we arrive at the anesthesia workstation, the command center of the procedure. This is where the anesthesiologist takes the reins, controlling the delivery of anesthesia and monitoring patient vitals from start to finish. It's an essential part of the surgical process, providing a hub for all the different components of the anesthesia system to come together. The workstation may seem complex, but don't be daunted. Think of it as the conductor of an orchestra, integrating and directing all the components of the anesthesia system to create a harmonious surgical experience. It's where the anesthesiologist can manage the anesthesia machine, breathing systems, and monitors, ensuring everything runs smoothly. The workstation allows the anesthesiologist to control the delivery of anesthesia. It's not just about turning a dial and setting the machine in motion. The anesthesiologist can adjust the levels of anesthesia throughout the procedure, responding to the patient's vitals and the demands of the surgery. It's a delicate balancing act, and the workstation provides the tools to manage this with precision. But the workstation isn't just about delivering anesthesia. It's also the central monitoring hub, providing real-time data on the patient's vitals. This includes heart rate, blood pressure, oxygen levels, and more. It's a constant stream of information, allowing the anesthesiologist to respond quickly to changes and keep the patient safe. The workstation also integrates the different components of the anesthesia system. This includes the anesthesia machine, which delivers the anesthesia, the breathing system, which helps the patient breathe during the procedure, and the monitors, which keep track of the patient's vitals. It's an all-in-one hub, bringing together these different elements to create a seamless surgical experience. So, you see, the anesthesia workstation is more than just a control panel. It's the heart of the anesthesia system, where the anesthesiologist can manage the delivery of anesthesia, monitor the patient's vitals, and integrate the different components of the system. It's a vital part of the surgical process, ensuring the safety and comfort of the patient. Understanding the anesthesia workstation completes our exploration of anesthesia systems. Let's quickly recap all that we've learned about anesthesia systems. We've journeyed through the intricate world of anesthesia systems, unraveling the complexities that lie within. We discovered the core components of these systems, which include the anesthesia machine, the breathing system, monitors, and the anesthesia workstation. The anesthesia machine, the heart of the system, is a marvel in itself. It's responsible for mixing gases in the right proportions, ensuring the patient receives the correct concentration of anesthetic and oxygen. With sophisticated controls and fail-safe mechanisms, it ensures the safe delivery of anesthesia. Next, we explored the breathing system, the pathway for the anesthetic gases. It consists of tubes, filters, and valves, all working together to deliver the anesthetic gas to the patient and remove carbon dioxide. Monitors play a crucial role here, keeping a vigilant eye on the patient's vital signs such as heart rate, blood pressure, and oxygen levels in the blood. Then, we dove into the anesthesia workstation, the command center for the anesthetist. It's where all the action happens, from monitoring the patient's condition to adjusting the anesthesia levels. This workstation combines all the components of the anesthesia system, providing a seamless interface for the anesthetist to deliver safe and effective anesthesia. In a nutshell, the anesthesia system is a symphony of different components working in harmony. Each plays a vital part, and their flawless coordination ensures the patient's comfort and safety during surgery. It's a testament to the marvels of modern medicine, combining technology and expertise to alleviate pain and fear. So, there you have it. The complexities of anesthesia systems unwrapped, their mysteries demystified. You've walked through their inner workings, gaining an understanding of how they function to make surgeries safer and more comfortable. Remember, anesthesia systems are essential tools in healthcare that ensure patient comfort and safety during surgical procedures, and now you know how they work. You know how they